This is a muscle energy technique to improve rotation of the hip. Start by flexing the patient's hip to 90 degrees and assessing hip internal rotation and hip external rotation. The muscle energy technique should be performed towards the movement deficit. For internal rotation, passively move the hip into internal rotation and then cue the patient to move their ankle back towards the midline. The patient will hold this isometric contraction against your resistance over a period of approximately 7 to 10 seconds. The next step is to ask your patient to actively internally rotate their hip or move their ankle away from the midline towards you. This will be followed by another isometric contraction towards the midline, which will facilitate activation of the external hip rotators. Once again, holding this isometric contraction for about 7 to 10 seconds. Upon relaxation, we then ask our patient to actively rotate their hip further, and we can passively assist this internal rotation. And this process can be repeated several times. This muscle energy technique combines autogenic inhibition or hold relax with reciprocal inhibition, aiming to improve total hip range of movement. This technique can be repeated for approximately 3 to 5 repetitions or until there is no further improvement in range of movement. Upon completion of the muscle energy technique, reassess hip range of movement.